communities all over the world in Tukwila and helping them navigate the incredibly complex bureaucratic healthcare system we have here in the States, and medical translation is involved, and there's ways for people to get involved in global health work right here at home in King County, but also in that sense of bringing it home and feeling like activists and advocates for social justice and improvement here in the communities where we do reside.
Whole thing. I would say that the question actually shouldn't be whether we should go abroad. I think it's how do we prepare to go. Because I think, like my colleague said earlier, we have the means to do that. Some countries do not have the means to do that. But if we have the means to be able to travel abroad and work with others and see, we should be more prepared on how we are going to really have that interaction so that it's a positive and lasting interaction beneficial to both, instead of saying that no, that we should not do it, because then that would be depriving folks from that opportunity.
So I want to invite Gary up to the microphone. So we have a question.
First off, Rebecca, as a public health nurse student, I'm in awe of your accomplishments, and I really enjoyed you sharing with us. My question is for Dr. Sidram. You spoke about the code of conduct for the NGOs, and then you also spoke just in your last comment about population health and inequalities. Do you feel that NGOs, if they have strict adherence to the code of conduct, they avoid certain countries that have these great inequalities, that the NGOs are unable to reach that population?
Well, first I should say I'm only citing the Healthline's International Code of Conduct. I might actually pass it to Alma, who might know a little bit more about it. I'm in awe of it as an idea, and I think it's a great starting point. I don't think it precludes from working in countries where disparities are tremendous, and I don't think they're necessarily insurmountable. I think the Code of Conduct is a guideline for working to strengthen health systems. I don't. I'm going to pass the microphone to Alma to let her talk about it, because I know she knows a lot more about it. But I don't think it is a way to weed out or kind of say, well, we're not going to work with them because they wouldn't be able to adhere to these guidelines. I think it's actually more for organizations that seek to work countries that struggle with disparities and inequalities, and figuring out a way to do it in an ethical way, and also bolster them from the ground up and support the public healthcare system. But I will definitely pass this because
I have a whole lot to add to it, but I think our code of conduct concept came from work that we did in Mozambique and Uganda, where we noticed that the government officers, individuals who were trained to work as physician, nurse practitioner in the government setting, when we NGO come, then they will leave the government and then come work for the local NGO at a salary that's sometimes 3, 4, 5 times higher than their counterparts in the Ministry of Health. So then they are the ones that are becoming the bourgeoisie class. And it really creates friction. And often if the local NGO is not able to do all the activities that they need to do, so they need to partner with the Ministry of Health. And then now this person is going to go and try to get services or partnership from the colleague who now sees the person as an outsider because the person has a different lifestyle. So it really became, so those are some of the things that inequalities basically, those are the things that really promoted us to really come up, develop this code of conduct, which is really be aware of what is there and what our action, we may mean well by our action, but it turned out that it's creating more disparity, inequality problem in the society. So if we know that, I think it prepares us better to do the work that we do. So for us, we do have a salary scale that is a little bit higher than the Ministry of Health, but usually much, much lower than many of the other NGOs. So sometimes it's difficult for us to really keep our staff because they can just go to another NGO and make 3, 4 times as much. But we try to really make them understand that it's a commitment. The dean was talking earlier about really commitment in what we are doing. So if you're really committed to the work, if you have the passion, like we heard Rebecca talking about it earlier, if you really have the passion, then it's amazing how we really get to have people work with us for many years, because it's all the other things that they see as beneficial. We're talking about the university, being able to really connect with the university, being able to work with students, going and working on their thesis. So we find different ways to really connect our colleagues, our partners who may have less than what we have here. And so I think the code of conduct is more of a guide. And it does not mean that we should not go there. I think more so that's the, we understand this is what should guide the way we do work so that we can decrease the negative impact.
Are there any other questions from the audience or cards that we missed? Yes, please, come on.
So, I'm an alumni from SU and a nursing, an RN as well as I'm getting my master's in public health. So this is more of a logistical education question, I guess. And what do you guys say about the tracking that's happening, I think, in university education, where in order to do global work, it's like you have to start down this path. And it can be hard to make this transition, I think, between doing work here locally and going globally. So the more and more that you work in the U.S. and sort of build your career this way, then you get to a certain point in your education or career where everyone says, well, we need those 3 years of international experience to hire you. So I wonder, how we try and break down some of those silos to sort of say, here's some transferable skills and kind of have it not be quite so competitive for people who want to be able to kind of flux between different types of work.
I'll start. One thing that we like to do is build long-term relationships with international organizations, because the more frequently you go and the longer you go, the more doors they open for you, the more trust. We usually find, we talk to students about when you go abroad, you have to be very, very flexible. However, usually when you're being asked to be flexible, they're trying to do something additional for you that's really nice that you just didn't have on your schedule. You're squeezing one more thing in. If you're trying to build a resume for some future work in global health, perhaps to have 1 or 2 international health relief kinds of organizations that you work with repeatedly might get you deeper into experiences and kind of richer experiences to list on a resume if you apply for another kind of job.
That was a very good question, very hard one. And we have candidates for the Global Health MPH program, and we're going through, just for 10 position, you have like 100 people applying for it. It's very, very competitive. And sometimes it is really, most of the time it's very, very challenging to select who, sometimes among of the group we have just clash because one person thinks this is the best, that person has the best qualification and another. And I don't think there's an easy answer that I can give, but one thing I would say that given the diversity of the population, that really being able to speak a foreign language has really been a plus. And yes, being able to travel or have experience overseas working with a diverse population has also been a plus. But we also have individuals who have worked with diverse population here. And I think it's really when you do the work, if you do it with passion, that you can really express it. And when you apply for a position or whatever you can, or position in the school, you can really express it so that people know that the experience that you had there was really concrete, was really valuable. As some people don't know how to sell what they do or what they did. And I think that's the key thing, to really be able to really get the most out of that experience so that you can present it in a way that really make the reader understand that you really got into that community that you were working with. You just didn't go and just checked, but you really got into it. I think that we very much appreciate that too. So it doesn't have to be just that you have to have being able to go abroad. You can do it here, you can do it well, you just have to know how to market yourself.
I was just going to add quickly, I think one of the things that we need to continue to do as a community in all aspects of our community is to continue to educate people. And one thing I think CLU does really well is they look more at the holistic person. But even with donors, I have to go to donors and explain why I want $100,000 to build a mortuary, and that's not a pretty idea for them. And the best thing that we can do is continue to educate the people that we're working with and the communities that we're working with, and show how important you, or how valuable of a global experience you were able to get right here at home. And I think it's through people continuing to break down kind of barriers of what minimum requirements are, or what letters are after your name, are things that we need to continue to look at as a society of how do we examine more of a holistic person and not just someone on paper, whether they've been working abroad for years or they've been working in the Pioneer Square Clinic. You know, those two experiences shouldn't be lined up next to each other and say, well, one was out of the country and one was in the country. Because the financial resources alone are very high, and some volunteer organizations charge even more on top of that to secure things, or to provide things like a security and a roof over your head. And so I think the more that we can continue to always challenge ourselves as communities and look at why we do things a certain way and what we could do differently to open the doors more to other people that are interested in doing the local work. Because I think sometimes the global work is kind of a more beautiful appear to it. It's an exotic, let's travel abroad, but there's plenty of things that we can all do here at home as well. So just by challenging those requirements, I think are a great thing for us to do.
One thing, yeah, I think this phenomenon is growing, right? This idea that you do need to go abroad, and I think it makes sense if, as global health practitioners, we do want people who have experience on the ground doing the kind of work. For my research, I was looking up statistics, and some statistics I was recently looking at the other day reminded me that they do kind of matriculating surveys of incoming and outgoing students, and I was looking at the Association of American Medical Colleges surveys, and I was just comparing numbers from a few decades ago. 1984, only 4% of all graduating medical students in the United States went on what was being called International Health Program, IHP. It was the International Health Program before it was called Global Health. 2012, matriculating all U.S. med students matriculating in the United States, 67% checked the I want to participate in global health, what was then being called global health experience box. And of those who graduated, something like 75% of those actually went. So it is true. We in terms of marketability and competitiveness, yeah, that is increasingly something that not just, if you want to be involved in the healthcare field, employers of all kinds are trying to see what kind of well-rounded person you are and what experiences you've had. And I think the trend is in global health, the idea that to be a global health practitioner, you just kind of develop a skill set of epi and biostats, and then you can go wherever you want. I think maybe, kind of what Rebecca was saying, and Alan was saying, the deeper you get, the connection you have to one place, being able to say and be confident that you know histories in that place, contemporary patterns of structural violence introduced in traditional forms of care, agricultural patterns, and dietary changes, and to be able to speak the language. In working in one place, it might be not a thing, all eggs in one basket, but maybe that's the best way to phrase it. Maybe a deeper, longer connection to a place would serve someone better in terms of showing they understand some of the complexities of working with diverse populations.
So we want to be mindful of your time this evening, and I just wanted to finish with a couple of closing remarks and some acknowledgments. I think we've really just begun, for those people who are interested in this topic, to sort of break through some of the boundaries between our ideas and our ways of thinking about global engagement from all of the health professionals profession standpoints and from different points of view, both within and outside of the U.S. On behalf of the Dean and the Global Nursing Community and my co-moderator, Karen, we'd really like to thank our keynote speaker, Rebecca, and our panelists, Aqua, David, Suzanne, and Carl, once again for tonight's rich and nuanced discussion. As we've heard, the importance of experience with global and diverse populations continues to be a focus of today's healthcare and health promotion systems in their various forms. As we work to prepare nursing leaders equipped to forward SU's vision for a just and humane world, we will continue to work to provide them with cross-cultural opportunities, both at home and abroad, so that they can meet today's nursing challenges with both experience and confidence. Thank you tonight for your kind attention and your participation. Good night.